Hello, everyone, and welcome to the VBMA Podcast. If you're a returning listener, thank you so much for coming back. We are glad to have you with us again. And if you're tuning in for the first time, we're excited you're here and hope you find something valuable in today's episode. This podcast is made possible thanks to the generous support of our national sponsors, the AVMA, Simmons and Associates, and Merck Animal Health. We're incredibly grateful for their continued partnership in helping us bring business education and leadership conversations to veterinary students across the country. Let's jump into today's episode. Hello, everyone, and welcome back to another episode of the VBMA Podcast. Today, I'm joined by Dr. Sarah Vigil, who works for CityVet here in Austin. I've had the privilege of doing a 4-week externship here during my 4th year of veterinary school, and I asked her to be a part of this podcast today to answer some questions and just get some general advice from her. Dr. Vigil, welcome to the podcast.
Thank you so much for having me.
Okay, so let's go ahead and jump right into it. My first question is pretty standard. Can you tell us a little bit about your journey to becoming a veterinarian and what led you to explore ownership?
Yeah, it's a great question. So I've always been drawn to animals from a young age. I've always wanted to be a veterinarian my whole life. When I was young, I wanted to be a dog. My parents told me that I couldn't be a dog. And they taught me what a veterinarian was since I couldn't be a dog when I grew up. So I've always had love for animals, always been drawn to them. They've always just brought me comfort and happiness, and they're always there for you, and they're always wagging their tail when you come home, ready to jump on your lap. And I've always also just been really good at problem solving too. So it actually works together to have both of those things to be a great vet.
Yeah, absolutely. I think wanting to be a dog to being a veterinarian's a great pipeline. I'm glad your parents deferred you from wanting to be a dog, but that's awesome.
Not really realistic.
No, not really. So I guess my next question is what drew you to CityVet's model of practice ownership?
So I did get a lot of experience. I've been on about 12 years, had some mentorship along the way, but I also went up the leadership ladder too. So got into more of the business side of things. I did notice how leadership decisions did impact the client experience, patient outcomes, but more importantly, how the team morale is. So if something were to break in the clinic, can we get it fixed and quickly changed over? Then there'd be some barriers in the way. And I just never understood why we couldn't get something fixed so quickly. And so I wanted to be a part of building a positive workplace and culture that prioritize work-life balance, create a trusted and reliable client experience as well. And I wanted everyone to feel very valued. Um, and in general, just wanted to be proud to lead a team that shares the same vision with me.
Yeah, awesome. Well, you mentioned all these great things, positive culture, good work-life balance, etc. How do you create and maintain that in your hospital?
Yeah, I treat the team how I want to be treated.
Yeah.
I set the tone of the clinic, walk in, say good morning, making sure everyone's taken care of, making sure, of course, any issues with clients, making sure they're taken care of as well, making sure all the pets in the hospital are good, especially if we had pets from overnight boarding as well. With my own experience, I've been in toxic environments in the past, and I wasn't able to get a very growth mindset at that point and felt very trapped. So I really didn't want that type of environment here. So I really tried to strive to be very positive.
Awesome. Well, that's great. And something that I've really noticed at the hospital here, and I don't know if I've told you this yet, but I really like that you guys do the huddle every day, especially like starting off the day first thing in the morning with that. I think that's awesome. But my favorite part about that is actually the gratitude portion. I think that when we're recognizing a technician for getting their first catheter, it really sets the morale and it tells everybody here that we're proud of you and we like to see everybody grow. And I think that recognizing that is really important to the overall team culture and dynamics.
Yeah. A previous place, we had the huddles there, but they'd always talk about what was a negative experience from the day before, or what clients are upset. And like, what? And I remember asking, like, why are we talking about that? Why aren't we talking about the good things that happened the day before? And how do we learn from our mistakes or client mistakes, or how can we improve their client experience here? So that is something that I didn't want, and I wanted the gratitude, right? So to recognize people and what they're doing, even if it's just a simple little, I got my first blood draw today. Because it is a big step for them in order to go from that to being surgery trained to even going off and getting to be like a licensed vet tech or even going off to vet school. There's all these little steps that they have to go through.
Yeah, that's awesome. And then my next question to build off of that is your team's growth and well-being. How do you support that?
Positive reinforcement. So it's kind of like just like with our pets, right? So making sure that they know that they're valued, respected here. I do with the positive reinforcement, there is something that we can give a just wag, is what it's called through CityVet. And that's where we just give a form of recognition with our 5 principles that we have here. So that we are family, and it talks about things that we do for each other. As well. So just sending them a little just swag just to kind of brighten their day. Also to help with growth and well-being, having a very strong practice manager that aligns with the same goals and morales comes from strong leadership. And we both complement each other well too. That definitely helps us that we're on the same page. And then we pretty much just like to set SMART goals with growth within the hospital. So, like we mentioned, blood draws, moving up to IV catheter placement, getting surgery trained, and then having them improve from there. So, really just trying to support them along the way and realize that it's okay to fail because we all fail at some point, and just trying to keep that growth mindset and keeping things positive.
Yeah. Well, you've mentioned a few times now about like placing a catheter and then surgery and then maybe licensing. Is that something that you expect from them, or are they coming up with these ideas themselves and are you supporting them? Like, how does that usually go?
Yeah, usually it's their ideas themselves that they want to do that. If they don't bring it up, then I'll even say, hey, have you ever thought about going to vet tech school? Because you really excel in these areas. And I think that'd be very beneficial for you because it does help you be able to do certain things in the hospital more and have more independence here. I mean, you can suture up a quick little laceration, or you can suture up the skin for me as like a licensed vet tech. Well, I can go see the next patient. They can suture up a tooth extraction that I've done too. So those are some things that are helpful. They can run their own tech visits. They can have their own tech visits scheduled to where they can be doing lots of client education, anal gland expressions, nail trims, giving some injections while under the care of me, but I'm still often seeing other more like critical pets that
Hmm.
need to be seen
Yeah.
by the doctor. So it's usually them that wants to do that, but I have seen some that I have to push a little bit to go to improve.
Yeah. Well, I guess like from a business perspective, it's beneficial as well, right? If they're
Mhm.
bringing in their own revenue, like from tech appointments and whatnot, we can double the amount of time that we're spending, right? So it's like, in a way, your support is bringing in you more money, which I know it's not about all about money, but it does turn around for you, which is good. And I didn't really think about that
Yeah,
aspect.
yeah, absolutely.
Yeah.
Sure.
So, what are some pleasant surprises you've encountered in your ownership journey?
I've definitely learned to understand to be flexible. Plans will always change. The floor plan changed whenever we had a plumbing issue here. So just, actually like the floor plan better the second time around. I was like, actually, that sounds great. That's perfect. Why don't we flip that over? It actually worked for the better. And then we did have some plumbing issues to where it changed one of our kennel runs and it wasn't able to be finished for a few months, but it didn't really hinder us. So it's just one of those, yes, this is a problem. It needs to be addressed in the back of our mind, but we can still work around it. One thing I was surprised was also many people will have their own very strong opinions about how the vet clinic should look and run, how you should do things a certain way, and you realize that you just can't make everyone happy, which is something that is hard for me to do because I want to make everyone happy. I think every veterinarian does. So I want to make every client happy, every patient happy when they come to the clinic. One thing that was a big surprise that I remember, it was like a big exhaustion from decisions was being asked where to put all the leash holders. Something so minimal. Where do you want your leash like holders to be in the hospital? I don't know, by the front door, by the kennels. I mean, even just, do you want it here? Do you want it there?
Yeah, like, who cares?
Just have leashes around.
Yeah.
I never thought of it to that point until they asked me. And the paper towel holders, here's all your paper towel holders. Where do you want them hung up? By the sink? Like these things that just you don't think of and you're like, okay, this is something so trivial, but it is important and then we need to have it here. Um, those are definitely a few surprises that I was like, I never thought I'd have to be telling them exactly and how high to put a leash holder.
Yeah. Right. Absolutely. What about like good surprises? What is something that you're just like, yeah, that has been like, that's been pretty good.
I would say my team has been very good.
Yeah. I agree on that one big time.
Yeah, the hiring process, me and my practice manager were very nervous about it, but we definitely found a lot of people that go together with us and mesh well with our personalities. And so I feel like we got very lucky on that. We did have some people that didn't have as much experience, but I definitely want somebody with a ton of experience, right? Somebody that's surgery trained. I needed to have at least one surgery trained person here so we can run surgeries, ideally most days. And then uh, I was okay with somebody less experienced as the second technician because I could help them grow and develop. We're a new hospital opening up. I had that time for that. Um, and they were just like an overall good person. I didn't want to pass them up. There were other people that were way more experienced, but I could just tell they wouldn't mesh well. There would be drama, there would be issues. And
Mm.
so that's something I had to kind of take a little journey on to see if they'd be a good fit. And they are, and they're actually amazing and doing great.
Yeah. And to build upon that a little bit more, to talk about like veterinary students, like as potential employees, right? So like externs, or if you were to hire a new grad, what are some things that you would look for when someone is spending time here with you?
Yeah, definitely ones that have similar goals. So making sure that the pets are taken care of first and foremost. That's why we're here.
Mm.
We're not going to be turning away patients. We're going to be making sure everybody's taken care of however we can. That seems to be the best fit for the hostel and for that day. Also, want to make sure that our personalities mesh too, especially for new people coming in, and making sure that we're on the same page with everything as well. A big thing is positivity. I definitely like that. Getting along with the team, of course, since you're going to be working closely with them. Being flexible, especially with a newer clinic. There's going to be some days where it's really, really slow. The phone's not going to be ringing. We have caught up on everything, but just trying to make sure we're still doing some learning and making sure the hospital is doing its deep clean and, just make sure those little things are still getting done. And then also just being able to step in where needed, just making sure that everything's taken care of, the way everything's running smoothly.
Yeah. So if I'm hearing you correctly, it sounds like it's a lot of like adaptability and positivity and just like someone that's going to foster the team atmosphere.
Absolutely.
Yeah.
Yeah, for
Okay.
sure.
Cool.
Yeah, because I'm not going to be here every day, right? And so they need to know what the expectations are, and if I'm out sick or something, then they need to know, like, what needs to be done and, "Oh, this is how Dr. Vigil does it, so this is how we're gonna do it today while she's out," and they know what that looks like.
Yeah. Okay. Well, if what advice or skills would you recommend that students start developing now? If they're interested in ownership or even just like an associate position, what skills do you recommend to just be a good veterinarian that has an acute business sense?
Yeah, efficiency is gonna be a good thing. That is something that does come with experience, though. That's hard to teach efficiency, right? But just knowing I have these rooms that are back to back to back, and then I need to make sure that they're all taken care of. I need to make sure all the medications are ordered up and they're treated, and then they get filled while I take care of the next one. And you don't get behind in your schedule. That's definitely something that was a struggle with me as a new grad was efficiency, but it just comes with time that you're going to get familiar with that, and then also knowing where your resources are. So using certain websites. To find stuff, right? Or quick resource for finding a drug calculation, just making sure you have that ready to go. That way it's easier for that too. And then just like you mentioned, being adaptable in the environment, knowing how to be quick to change things around too, especially if things aren't going the right direction that day.
Yeah, that makes sense. I think also probably like knowing what you can and can't get done in a certain period of time. Like today, like we had this blood that was may or may not running. It was running up errors on us, and you're like, "Hey, pull up more blood in case while you're doing your ultrasound. That way
Yep.
you're not like wasting an additional 10 minutes to run blood. It was already ready to go." And I think that's not something that comes naturally. It's just like, I'll get this done first and this done that first and or second, and it just makes sense to do it that way. And that's that comes with experience. So I understand that perspective as well when it comes to efficiency.
Yeah, it definitely comes with, like I mentioned, with experience and just I came from very high volume practices. And so just having to figure that out on my own and making sure, because I don't not like people waiting at all, especially clients. And so just making sure everybody can take care of, or the really stressed out pet, right? That's barking in the lobby, that's in the exam room, panting, stressed out. I try to get them in and out as fast as possible.
Yeah, that makes sense. What values do you live by in your hospital that you think make a difference in your team or client experience?
Yeah, so definitely just being professional and making sure that everybody is taken care of. I guess that I'm just more of that nurturing type, right? Just trying to make sure that everyone's good, everyone's having a good day, making sure everyone's taken care of as well with like, hey, it looks like we have this dental coming in today. Have we set up for that? Has the blood work been run, right? Have we gotten their pre-vitals? So I'm just trying to check in with that and them knowing what their expectations are, and then they know what my expectations are as well, so it can become more efficient.
Yeah. I think from the client perspective, something that I've noticed from my first day here is that you are quick to get on the ground to talk to them.
Yeah.
And I think that you like reach for the dog, give them a pet, and then talk to the client, and the clients really appreciate that.
Yeah.
So much so that if you have mentioned that, like, wow, you're the first person that has really like sat down with me and talked this through, or now I understand why we're on this medication or why it's important to do follow up blood work like after starting a new medication. And um, I think taking that time, I know you talked about efficiency, but I think that that is being efficient. You are prioritizing that, and I think that that sets us apart a little bit, sets this hospital and definitely you as a doctor apart. And I think that they are teaching us that, they are teaching us to get at the client's level and to make sure they're actually comprehending what you're saying by asking them, like they're ask, tell, ask, where you ask them if like what their understanding is, you tell them all this stuff, and then you ask again, like if they comprehended it. And it usually is like really weird when you have to be like, all right, I told you all this stuff. Can you repeat back to me like what I said? Usually that's like really bizarre in our OSCEs and stuff to have to do that. But I think just like taking the time to slow down when you're telling them things is I think it has really great returns on that. And I think setting that like follow up like email really helps. And I know talking about efficiency, you love ScribbleVet and
Yeah.
it's like AI scribes.
Oh, yeah, absolutely.
Can you talk about a little bit more about some technology that you've embraced here?
Yeah, definitely. Because I didn't I wasn't doing AI Scribe or Scribble Vet here like 4 months ago. I was
Okay.
still typing everything out, and I'd have all these templates for everything, I'd copy and paste everything, but now, yeah, it just, like, goes back to that efficiency piece, and it catches stuff in the exam rooms that the client and the technician talked about on their history before I even go in there. So even when my scribble is done and I look at it, I'm like, "Hey, they mentioned this?" They're like, "Oh, yeah, I forgot to tell you that." So it's also making sure that I'm thorough as well. And then that follow up email is really helpful too. And kind of going back down on the getting down to their level, clients just want to be heard and understood, and they want to be listened to. And they know their pet way better than I do, right? I know the medicine side of things, but just trying to come to the realization that we can work together as a team and collaborate together. And that way we are able to get the best treatment plan for your pet so they can have the best future for them, and kinda know what those expectations are as well.
And then I think like technology wise, I've seen you embrace some things like, and you're very welcoming to new technology. Like you have the Imagist, and like you're willing to play with that, which I think is nice. And then additionally, I've seen you use the ultrasound with the like webcam feature, so you can talk to um the like virtual or
Probably telemedicine.
yeah, but like
Yeah.
the consult.
Mhm.
So I think that like in those ways you're willing to try new things, which can be unusual for certain veterinarians. So I think that it's not just that like you have this new hospital, it's that you're willing to like use the new things that you bought.
Yeah,
And I think that sounds great, but also like that's bettering the medicine that you're being able to offer.
exactly, yeah, and it has been very helpful too, especially with the Imagist. that frees up our time for a tech to sit there and scan and read a fecal slide, right? That the images can read. Could probably catch things maybe even better too if there's just one tiny little GRD on there compared to a tech that's in a rush trying to get to the next room and they're trying to read the fecal. I've seen that happen before, So the images can do its job. And then especially with, like you mentioned, ultrasound, having that webcam and somebody like me that doesn't have a lot of ultrasound experience, if we're coming here, I could do cystos just fine, but being able to scan the abdomen, I didn't have a lot of experience because those hospitals I was at didn't have a good ultrasound. And so being able to log in and talk to somebody through webcam and they can guide me through, and I got training done through that, which is helpful as well. That way I can do these ultrasounds and send off the images and the videos to a radiologist, and then I don't have to wait on an outside service to come through. That way it's better medicine for the patient to get it done same day instead of having to wait 3 to 7 days for an outside service to come in.
Yeah.
So,
And even from like a revenue perspective,
yeah,
I'm sure that's bringing in more like profits to your hospital, right?
absolutely. It definitely does too. Yes, for sure. That is helpful for that as well. I definitely do enjoy doing that.
Yeah. Okay, I'm gonna ask you one last question, Doc. You have done something crazy, which is you are opening two hospitals within 18 months. It's like 202.
Yes.
Can you tell us about that?
Yes, this
What
is me. This is me.
craziness took over you?
Well, I mean, I before this, I had opened up a hospital with one of my previous clinics I was at. So I was like, well, I did it once. Why can't I just do it twice? I just do it with CityVet since I really enjoy their model. And since they have that extra support to help me through. So I presented it to them and they were like, let's think about it. And they're like, okay, let's see how we do. I think it's just I'm hoping it's enough time to get this first hospital up and running and confident and having the good team support that I want to have, and they know what the expectations are here. That way, I can split my time between two hospitals, and also just serving more of the community too. Of course, I'd love to replicate myself 4 times, but it's kind of hard to do that. But if I could at least see some people in the Brushy Creek area and then go and see some people in the Leander area, that could definitely just help me help more pets, and then also developing the team and making sure everyone knows they're getting still good care, even if I'm not here and they have to see another doctor, that the hey, Dr. Vigil hired them. Hey, she has these expectations for them. And so if there's any issues, then they can always reach out to me. I like challenges. And so we'll see how this goes with the second clinic, hopefully in the next year.
Yeah, well, that's awesome. And I guess it really shows that you have to have a lot of trust in the people that you're hiring, right? So it just goes back to building that team. It's really important that you spend that time trying to really get to know all of these candidates and especially like doctors and leadership, that like the trickle down effect is one that's cultivating a positive culture, right?
Yeah.
Awesome. Well, thank you so much for being on our podcast.
Thank you for having me. I appreciate it.
Yeah.
I feel very honored.
Yeah. Well, let's go see some rooms.
Let's do it.
Okay. Bye. Thanks everyone for listening.